Hey, what's good, fam? Welcome to another episode of the Feed Me, Fuel Me podcast. Durs and Jeff coming to you from Scottsdale, Arizona. And today we've got the pleasure of sitting down with Dr. Rachel Hasslebrock, owner and founder of Alinea Health. Claps, golf claps.
Crushed
That's
it.
how you do it?
Crushed it. He got the name right, which I'm very thankful for.
Hey, professionalism is a courtesy.
I appreciate it.
Yeah.
Apparently, it's hard to say, so.
Really?
Mm-hmm.
Well, try having your name spelled with a Y. People church that shit up all the time.
Really?
What? My cow.
Yeah.
Yeah.
Me cow.
Interesting.
I'm like, man.
When I first saw it, I was kind of like, Mikael? Michael. No, I was just like, it's Michael. That's got to be.
I let people suffer through it. Like, if they're brave enough to just, test it in front of me, I just let it ride for at least 5 attempts.
Like, see what happens with it.
Yeah.
I'm with
like,
it.
are you just going to, give up the ghost and just be like, it's got to be Michael.
Yeah.
Right, it's got to be
Yeah.
something, right?
Darwin told me Durs. I was
Yeah.
like, who the? All right. Great.
So, most people are introduced to me that way.
Mm-hmm.
And then when they find out my name is Michael through somebody else, they're like, who the hell are you talking
Right.
about? But no, Darwin, a good friend and member at the gym, linked us up. He said that there was definitely a lot of synergy between what you do, what I do, and the method and philosophy with which we do it. And as a doctor of naturopathic medicine, I'm always interested in your scope of practice because within the context of naturopathic medicine, you have a number of perceptions that are like the first thing that comes to mind. Everything from acupuncture to essential oils to witch doctors. You know what I'm saying? But as we were having coffee the other day, we'll dive into this in a little bit. You had described what you do as not sexy. It's tough, and it's definitely the long road, compared to the perception of, conventional big pharma, westernized medicine. And to which, my immediate question to that is, how does the dialogue go when you reach a level of rapport with a client and you have to ask them, how bad do you really want to be well? Like, how in charge of your life, how responsible, what level of responsibility do you want for your health and well-being? So I want to dive into your perspective on how that conversation typically goes and what you believe the answer to that question to actually be. But for everybody who doesn't know who you are, where Alinea came from and how you became a naturopathic doctor, or why you chose naturopathic medicine in the first place, give us the cliff notes of where you come from and how you got to this point.
Sure. So I graduated from ASU 2013, I think it was, with a bachelor's in dietetics. And that was super amazing. But after you graduate, they kind of are just like, have fun. So you really don't know what you're supposed to do. So I knew I wanted to help people, but I didn't exactly know how. So inevitably, I just waited tables and bartended for 3 years. So I was like, getting people drunk is probably a good idea. Let's do that. Yeah, right? So after doing that for 3 years, just kind of shuffling around, I really got just annoyed with everything. And I wound up at a place that I won't name because they're here in the Valley, but I got a job there. And it was a weight loss company. And the caliber to which they operated was not up to par with my standards on how I think people should be treated in regards to their diet and what should be looked at and this and that. They were very much a business. They were very much just trying to push their product on you. And you couldn't deviate from that. You had to sell them this, that, and the other. And it was like, that's not nutrition at all. That's a boxed meal. That's crap, quite frankly.
Sure.
And so I was there. And then also at the time I was suffering from migraines. I did Muay Thai, which I told you about. And I got punched one too many times, I think, and I got whiplash from it. And which resulted in migraines. So I went to the doctor and I was put on all the medications and I even had shots at one point and none of that shit worked. And I was like, holy cow, like, what the hell am I going to do? This sucks. So a good buddy of mine was like, go see my chiropractor. And I was like, what? Like, that is bogus. Like, I don't even think I actually think that works. But I was kind of at my wit's end, and I was like, well, I really have nothing else to try. So I went in with him. It was 6 weeks, and I was fixed up, and I haven't really had a migraine since, maybe one or two. So that knowledge that I gained of knowing, like, look, you don't have to always take a pill or do some sort of shot or whatever. And maybe it's a structural issue. And if you just address the structural issue, things will right themselves.
Sure.
So after all that happened, you know, I was just like, this is something cool that I think I want to do. And so my now best friend had posted something on Facebook that she got accepted into Southwest College of Naturopathic Medicine. And I was like, what the hell is that? So I asked her about it, and she told me about it, and I just looked it up online, and everything they said online was just right up my alley in regards to ethics and values and everything like that. So I applied, and they let me in, and then they let me graduate. So
How long's that coursework?
it's 4 years.
Oh, damn.
Yeah.
Okay, it's pretty extensive.
It's med school.
Okay, legit. Yeah, I've never even heard of that path.
Yeah.
Interesting.
Yeah.
So what is the? I mean, I'm gonna sound really stupid asking this question, but I'll ask it anyway. With regards to your scope of practice, what is the difference between being a naturopathic doctor and just being an MD?
Okay. So biggest thing is we do not work in hospitals. So any emergency situations, your heart attacks, your loss of limb, your car accidents, your things like that, like, please immediately go to the emergency room. Like we, while we get some emergency medicine training for those instances where you just have to do something in the meantime while you're waiting for the ambulance. But big things like that, go to the hospital. We can't do anything
Sure.
until they figure it out. We can help supplement afterwards. Scope is really, we can pretty much do anything your Western primary care can do. So we can prescribe you medications. We can do minor surgical procedures. It's pretty equivalent, except for that whole emergency piece of it.
Right.
And also, we're not allowed in hospitals or typically like a Western medical office.
Sure.
They don't really like us.
Okay. So, I find that extremely interesting because I look at what you're the conflict, the line in the sand between naturopaths and westernized medicine, the same way, like the way the argument goes, the same way I look at the argument between CrossFit and bodybuilding. You know what I mean? Like, does it really need to be like that? I don't think so.
No.
We don't think so.
No.
People that are aware get it,
Yeah.
you know.
Yeah.
But it seems like it's simply just an industry thing. You are now in a category that poses competition. Would be my perspective on that whole conversation.
Totally. I think I'm with you on that. I think it's completely unnecessary. I think all doctors go into medicine because they want to help people in some way, shape, or form. And I think it has now just become us versus them.
Right.
And I think that's ridiculous. There are some things that, you know, MDs will do that I'm like, God, please go there. Like, they're going to help you do this.
Sure.
While there are other things that I can do that are different than them, and we both can achieve the same result. So
Right.
I think, unfortunately, the people who are the loudest in our industries are the ones who are making it seem like it's this huge, big ordeal.
Right.
You know, I don't know if they actually hate us. I hope not. Like,
Right.
we just care and we just want to help people get better. That's really all it is. But you know.
What initially got you started in like the health and wellness space? You know, taking dietetics and then, you know, eventually finding your chiropractor and getting into what you're doing with naturopathic now. What led you down that route? Did you have a, you know, athletic background growing up, or?
What a great question. Actually, I've never thought about that. Shoo-wee, what led me? I don't even know. So I moved here from Ohio when I was 20, and I moved in with my mom, And my mom was at that time taking classes at a community college in dietetics.
Okay.
And I went to some college in Cincinnati, and it was very, I started out in nursing, and there was a huge ass waiting list, and I was like, no. So I switched to EMT, and I got certified as an EMT, and I tried to get a job. They don't like women. I don't know if that's true, but I couldn't get a job. No one would hire me. And then I went out to be a firefighter, and before I took the test in Ohio, I moved out here. And so I took the firefighter test here, got an interview. It went fucking terrible. It was really, really bad. If anybody does a fire interview, like, you guys are amazing. It's really hard.
What's
it's
so hard about it?
So I'm very bubbly, I guess you could say.
Yeah.
I'm very like, hi, how are you? Like,
Sure.
you guys are great, whatever. And it's just 5 people just mean mugging you and just staring at you. And they're like, what do you bring to a team?
Panel style.
Yeah. And I was like, oh God, I don't know. Like, I wasn't prepared at all. It was horrible. So if anybody goes through that, you guys are amazing. So that was that. Shoot, where was I? I don't remember.
Your path to naturopath.
Yeah, I know, but
You tried out for did your fire interview?
yeah. So that didn't work out. So then my mom was taking these classes in nutrition, and I actually just started like flipping through one of her textbooks, and I was like, holy shit, this is cool. Like, I like how things work. I like knowing like the pathways that food goes through when it goes through the body, and your fats and your carbs and your protein, like all that. Like, it was just super, super interesting to me. And so I really was like, wow, I don't know what else I'm going to do. So I kind of just started taking classes, and it stuck, and it worked out, and it was really fun. So
That's interesting.
yeah.
That's cool how you can just stumble upon those things. Just like, it seems like happenstance, but it's like, I don't know if you believe in the universe or whatever,
totally.
but it's like pushing you in that direction. It's pretty wild, because just to read a textbook and just to latch onto that, that's pretty interesting how that happens.
It was pretty neat. I was thankful because I was like, great, now I actually have something to like work towards, and nobody will interview me at the end. So it was good.
Just like, I'm good. No,
I know, right?
5-panel interview to
There
get this
wasn't.
happening.
And there was minimal math, which was also good. So I was like, thank God.
Yeah, that makes it.
So
Much better.
As far as now that you're off on your own with Alinea, how has that journey been up to this point?
I love the hand claps. I love it.
Because him and Darwin are the only 2 people who have said it right.
You don't understand. Like, I'm super sensitive to that shit.
Yeah.
I can't stand it when people mispronounce stuff.
It's terrible. What was the question? Sorry. What has it been like?
Yeah.
Ooh.
The entrepreneurial journey, if you will.
Yeah.
It's been good and terrible simultaneously.
Absolutely.
So like in school, we get very minimal business class, which sucks.
I didn't get any, so at least you had
Fair
some.
enough. Yeah. Well, we're not going to go into that. But they tried, with quotation marks on that. So, I sort of had this idealistic thought in my head that when I got out, people were just going to be like at the door, like, yeah, she's so amazing. I got to work with her. I want to work with her. She's amazing. And I am amazing, and you should work with me. But also, that's not life. And that was a huge, not slap in the face, but I was like, holy shit, we're all the people. What the hell?
Yeah.
So getting patients is hard. In the sense that not everybody is on the same wavelength in regards to health and how they think it should be handled and this and that. But the actual building of the business has been super cool and super just, I don't even know. I'm just grateful for it. Like I got the opportunity to try something that, no one else at my family has really tried. And it's been super cool just to be like, I don't think I can do that. And then you do it and you're like, holy shit, I did it.
Yeah.
That's super cool. Or when somebody like, you give someone your card and they call you and you're like, I really liked you. I really want to work with you. You're like, holy shit, that's super cool. Like, you know what I mean? I don't know.
Right.
So, but definitely challenging times. I'm sure you're aware. Like, you just kind of think to yourself, like, I literally have no idea what I'm doing or how to make this happen.
Sure.
But you just, I don't know. I just kind of roll with it. And
Yeah.
what happens, happens.
I mean, that's literally all you can do.
Yeah.
How'd you go about landing your first patient? Was it, just knocking on people's door like, hey, here's my card? Or was it ads? How'd that work out when you finally landed that?
Oh my So I'm not going to tell you the whole story.
Okay.
But I was actually covering at a clinic for a couple of my friends who were out of town. They're really good friends. And so they asked me to cover their clinic. And so she came in and just, had a bunch of stuff she wanted to talk about. And so we sat and we talked about it. And that was that. I don't even know. If you knew the rest of the story, you would crack up. But yeah, I don't know. That's literally how it happened.
And then after that was just sort of word of mouth building after that point?
Yep. Sometimes I'll just I'm very much, if I see someone I want to work with, I'll say, look, I really want to work with you because I think we'd be a good fit and a good team. And I know I could make some sort of impact in your life. So if you're if you're ready, let me know and I'll give them a card. And I've gotten a few people who've called me from that, which is super cool.
That's dope.
Yeah.
And when do you reach your bandwidth? Have you reached that point yet, or
No.
for your for one doctor taking care of all these clients? What would be that bandwidth point for you?
Honestly, I don't know.
Don't know yet.
So I don't know how it is for you, but you always try to take on more than
Exactly
you're actually
right.
capable of doing. So I'm worried that the point will come to where people are like, let me in. And I'm like, okay, yeah. And I'm like, oh my God,
Yeah.
this is it's a lot. So hopefully a lot,
Yeah.
Right.
so
Absolutely.
I can, do what I love to do and help people and make their lives amazing. But I don't have an answer for you on that.
Yeah, that makes sense.
I don't know.
Because I was just thinking, when you're taking all these patients, you're dealing with, their personal problem,
Yep.
and then when do you know, especially opening your own clinic? It's clinic, correct? That when do you know when to hire staff and start, growing the company beyond yourself? I think that's always the toughest part of being an entrepreneur. Like you said,
Totally.
we take on so much
Totally.
Right.
that there comes a point where you finally look at yourself and man, there's no, I can't handle
Yeah.
anymore.
Right.
I need some damn help.
Yeah.
And
I'm excited for that day.
Yeah.
In all honesty, I would really like to grow the company into something that is great for everybody who lives here. So they have access to good healthcare, and then also helpful to other naturopathic doctors. There are not a huge amount of opportunities around for us that are actually really good opportunities. And a lot of the times people wind up going on their own because the opportunities just aren't there, not what they want. So I'm hoping to really just grow it into this thing where I can bring people on and give them a great starting salary or great independent contractor contract, whatever, and just kind of help the whole community and I don't know, make
There you
it
go.
awesome.
Well, you're also, the way your business model is structured, from the way I understand it, is you're kind of in that early adopter pool of the way that the circles that Jeff and I run in, we all see medicine going, away from, the big hospitals will be where, the terminally ill, the trauma stuff gets taken care of. But as time goes on, people are starting to gravitate more and more and more to this concierge. I want a relationship with my doctor, not the the 10-minute consult, and then the PA takes care of me the rest of the way. So the fact that you're on that path, I mean, we all see it coming. So kudos to you for recognizing that as a legitimate business model.
Thank you.
And as retro as it sounds, the way I described it, it's actually the way that it actually should be.
Which is why I started in the first place. I didn't start it because I was trying to be some sort of new up and coming whatever.
Right.
What's important to me is that I have a conversation with you and that we get to know each other and that I know about your friends and family and your dogs and all that. I want us to be on that level so that when stuff comes up,
Right.
we can deal with all of it and not just one little piece of it, which is how it's dealt with now.
Sure.
So
Yeah.
I was just trying to do what I love. That was it.
That's the cool part, because I remember, you mentioned how you found it through chiropractic. When I was in high school, you remember, I call them the Hannibal Lecters, where you put these cages on your head and you hang the weight from it.
Oh, yeah.
And, you do for
The traps.
to build your neck. But I put so much weight on it that I you know, the curvature of your neck, I guess, is supposed to go
Thinking your shit out of whack.
Dude,
yeah.
it threw it the opposite direction. So I had these migraines that were excruciating, only on the left side of my head. So I got diagnosed with cluster migraines.
Yeah.
And I couldn't get it resolved. Like, I go to the doctor, hey, how do you get it fixed? And
I've
you know,
never heard this story
no,
before.
dude.
You're an idiot.
Dude. Bro, that's why I was such a banger. So it threw me off, and I was like, man, I had these terrible headaches, cluster headaches, man. And I was like, none of the doctors I went to could find a solution, whatever.
Sure.
Then I was in my anatomy class with Coach Brian, and he's like, you know what, Jeff, try going to a chiropractor. He's like, when I went, he's like, all of my sinus infection or whatever, all my clogged nose went away immediately after like I got my back corrected, because if your spine's in alignment,
sure,
you know, your body heals itself, is what he was telling me.
Right.
I was okay, I'll give it a shot. You know, lo and behold, I did. Went to the chiropractor and got my back aligned, and everything, the headaches and everything went away. And from there, I saw like, this is the way, man. I was like, I didn't understand why it worked yet, because I was still so young, and it was like my first time experiencing that.
Yeah.
But seeing how a traditional doctor that's you know, take a pill, call me in the morning, whatever, didn't work, and then going to a chiropractor where they actually resolved the problem and taught you how to correct it yourself, that changed my life. And from there, I don't even take like ibuprofen and stuff. But yeah, because, you know, it's like the traditional medicine, you see, everything is just like you said, write a prescription, get the hell out of the office. But then going to chiropractic or naturopathic, it's just like they're actually there to help you not come back to their office, so to speak, you know, heal yourself and to get things going.
That's literally the goal.
Yeah.
Is to like not ever see you again after you're better.
And that's why I see that's what I love, is because you can tell like people like yourself, you truly care about the patient. You're not just trying to, you know, extract dollars from them and have them coming back day after day after day, week after week. And that's why I love the path that you're going on. Like Doris mentioned, like people in this community see that path happening. And it's just so interesting how, like, you know, the big pharma, they just have so much money to make the change because their voice is with the dollars. But man, I think it's fantastic what you're doing, because literally that changed my life as far as like my thought process when it came to medicine.
Totally.
You know,
same for me.
Yeah, it's just interesting how that, you know, the world's collided at that point.
Yeah.
I guess I don't really have a question based off that. It was just like a story that I had that just came to my mind. I haven't thought about that in years.
I'm glad you found that. That's awesome.
Yeah, I haven't thought about that in years, but that's amazing that you found that path.
Yeah.
Well,
that's cool.
I'll tell you, we talked about this over coffee the other day. You know, as I, you know, continue to pursue my VA disability, right? I go into these docs looking the way that I look, and then they do their assessments, and they're like, "Wow, your knee is a fucking mess. Your back is terrible. Like, how are you upright? You know, stuff like that." And I tell them about the way I train, the frequency I train, and all that good stuff. And then I give them my credentials. Like, I feel like that's extremely important in talking to these professionals, because it's like, you know, oh, he's not just some dumb Marine. You know what I mean? Like, there's some. I would like them to think that there's some intelligence behind it, right? But they're like, the first thing out of their mouth from a diagnostic standpoint is cease all training. And I'm like, I think it's common knowledge amongst us, right, that should movement stop, all of these issues get worse.
Yes.
Right?
That's literally what happens.
100%.
Yeah.
You know, so the fact that, like, I go see, you know, these conventional medical doctors, I mean, it's part of the process. I have to. You know, I couldn't go see somebody like you and have you sign off on a diagnosis for a disability rating. Like, they don't they don't find that your opinion valid, which I think is a travesty. But in having these conversations, it's like, where is your side of the house with getting the greater population to understand that what we do in the fitness community, not just CrossFit exclusively, is indeed preventative medicine? Like, how are you guys as legitimate medical professionals bringing that to the forefront, considering the fact that almost 50% of America is borderline obese, and, you know, the epidemic of ill health that is plaguing our country?
It's hard. I'm going to be honest.
Yeah.
Because a lot of it, like you said before we started, is the patient taking responsibility for what is happening as well.
Yeah.
So I could talk somebody's ear off till I'm blue in the face. But if they're like, oh, I'm just going to go get this drug, they just want that quick, you know, they're taking care of it. They're handling. Okay. That's on you then. You know what I mean? So, you know, people get, not everybody, but they get attached to their doctors.
Okay.
Who they've had since they were, I don't know, 21 or whatever, 18. I hear that a lot. They're like, well, my doctor said this. And you're like, okay. And they don't really want to hear anything else.
Sure.
Or they get attached to their diagnosis and it's like an identity almost for them. It's like, it is interesting. And they have a hard time like giving it up, I guess. And for what that
Really?
reason is, I don't really know. I'd love to do research on
There's
that.
a lot of psychology behind that.
Well, yeah, totally.
Yeah.
But for people like you who we get to sit and chat with, and you guys are awesome because you're on board, and I'm not saying everybody needs to be on board, but you kind of get it and where it's going. And I think we're just trying to explain and teach simultaneously about different ways that can treat somebody with pain or who has diabetes or whatever that doesn't involve a medication.
Right.
You know what I mean? So diabetes, for instance, type 2 is completely a lifestyle thing. You know what I mean? Like it's not, your pancreas didn't just all of a sudden decide to stop working one day. Like you did it. And people, that sucks to hear, right? Like, man, I just gave myself this horrible disease. Like, shoot, no good. So if they can accept that fact, literally all you got to do, change your diet, exercise, good to go. You know what I mean? Like it's totally reversible.
Sure.
So just trying to educate people on that instead of just, here's a pill, good day. And I'm not saying medication is not important. It totally is. We've all used it at one point or another. Does a job great, but also for a lot of the things that are coming up for us, it's not just about that.
Right.
So
Right. I feel like there's, you know, with that, the identity that comes with diagnosis also comes an over-reliance on medication, which just like in the gym, when I tell people that, you know, to do their best not to train with belts, not to train with knee sleeves, not to train with grips, right? Because all of those things, helpful as they may be, over the long term can become a crutch. And you're not actually, we'll just use the weight belt for example, you're not helping your body adequately create intrathoracic pressure. So you're not bracing, you're not creating a strong enough core. Now your core has become accustomed to pushing against an external influence as opposed to doing its job. So then in the event that you don't have the crutch and then you ask your body to do what it's supposed to do, you come up short.
Can't do it.
Right.
Yeah.
So, I mean, I feel like what you're talking about is that exact same phenomenon from a medical and a prescription standpoint.
Yeah, totally.
And have you seen a certain demographic sort of latch on to the idea of, you know, naturopathic medicine, like the younger age coming up or athletes?
Is it a millennial thing?
You know, because I think they're the more open-minded, it would seem. I know I could be off.
I think the bigger argument is who are millennials anyways? What year to what year? I still haven't figured that out.
Yeah, that's a good question.
Thank you. Who?
Yeah, who is latching on to your school of thought and your
Definitely
practice?
the people who, from what I've seen, the people who are into health and fitness already to begin with, such as yourselves, because they make it a point to educate themselves on what it is that's going on and how can I get better at this and that. And then weirdly, not parents of younger children, but for the children.
Oh, yeah,
okay.
sure.
You know what I mean?
Yeah.
So like the parents are like, I'm not wearing any deodorant that has aluminum in it, and I'm feeding my kid all organic, and
No
they're
more
not getting any milk,
vaccinations.
no vaccinations. Yeah, none of it. But then you look at them, and it's they'll do everything for their child, but they have a really hard time doing it for themselves. So oddly enough, that's what I've seen.
Interesting.
Yeah.
Okay.
Yeah.
Yeah. Yeah.
So
What do you think causes that? Do you think it's sort of like, I guess they said generationally we get weaker as, especially men, like our dads are stronger than us, vice, on and on. They said because your parents want you to have a better life than they experienced. Do you think that's sort of like the thought process that goes into that? Even though they might not completely agree with the idea for themselves, they want the next generation to live better than they lived, for instance.
Yes. What you just said right there, though, is confusing to me because if you think that what you're doing for your child is going to make them stronger and better, it will obviously have the same effect for you. You know what I mean?
I know exactly what you mean. Yeah.
That was interesting that you said that. I never thought about that. What was the question? Sorry. What?
I guess, yeah. Why would you think they would latch onto that idea and help
kids?
Help the kids instead of accepting it themselves?
I think just like you said, and I also just think, I don't know how old you guys are, but I grew up in Ohio and it was meat and potatoes and boxed macaroni and cheese and Skyline and like all this horrible food. And that's just what you grew up on. You know what I mean? Like my dad, I don't think knew any better.
Right.
If he did, okay.
Yeah.
I don't know that. But, I think people just kind of do the best that they can. And I think also it's just habit. It's habit to go through a drive-through, or it's habit to drink your Diet Coke because you've been drinking it so long, or it's habit to do it for yourself. But if you can control it for somebody else, it's a lot easier to do that, to tell your kid like you're eating your broccoli before you get any sort of anything else. So, but you eating the broccoli on the other hand, you'd have to have some sort of willpower to get it in there, and then also realize like, look, this isn't a punishment.
Right.
You know? So, yeah, habit, I think.
That's interesting. Are you still, and I know you mentioned you did Muay Thai, right?
Yeah.
Are you still practicing that?
I try.
Really?
I don't let people punch me anymore. I do
It's not good to show up to work with a bruised eye.
Not even that. I'm just, the whole neck situation. I'm a little freaked out about that because I'm only 31 and still have neck issues. So I'm like, geez. But I do the pads and I do the bags and I'll do a class, and it's fun to just punch and kick something.
How's that helped you in your career and everything? Because that's like, that sport is, mental mastery and, physical mastery as well. Like, how's that helped you as a person?
Okay. Honestly, when I was doing it, I was a very insecure person, is the only way I can address myself as. And it was very like, I had to hit harder and I had to train harder. And I had just had this front of like, I'm awesome and amazing and this and that. And getting beat and getting punched was like a really hard thing for me to take. I like really beat myself up about it. So it's helped me to realize like, I don't want to be that person. You know what I mean? Like I was very, why am I not good enough? Why am I getting punched in the face? Why is this happening? Existential, blah, blah, blah. Yeah. So it really just helped me kind of like looking back on it, just be like, man, I was pretty cool back then too. You know what I mean? Yeah. Like it didn't have to be what it was. So if I had a chance to redo it, I would do it completely different, in all honesty.
Really?
With the training and the attitude and all that.
But it seems like there's always like not always, but a direct carryover in your case, like how the symbolism of getting punched in the face has carried over to, starting your own practice. And essentially, you're not really getting punched in the face every day, but,
kind of.
But it is like that. Figuratively, you are taking those shots.
Yeah.
Sure.
Honestly, I never thought about that. Would that be analogy?
That's an analogy.
Yeah, analogy.
Yeah, what a great analogy.
It's analogous.
Because it's funny because a lot of them, like mixed martial arts guys we talked to, Doug Larson, your brother, yourself, Doctor, and it's like people who have taken that martial arts background, I don't know if they're more in tuned, I guess you would say, but they've exposed themselves to different stressors that most people aren't used to or comfortable exposing themselves to, like physical altercation. And they're comfortable in that zone where if it happens, I'm good to take it there, but I don't necessarily want to take it that route. And it manifests in all stations of their life, I've noticed.
Yeah.
Well, I mean, you could take it one step further, and in the case, you've learned to take, accept, and rebound from loss on your own, which isn't necessarily a lesson readily available in team sports. Because there's, if you really wanted to, you could blame it on everybody else.
Sure.
Right?
Yeah.
It's
Sure.
not all your fault. But when it's just you and somebody else, mano y mano, well, guess what?
Yeah.
Either you win,
Yeah.
either you won or you didn't.
Yeah.
Yeah.
You know what I mean?
Yep.
And that propagates a different kind of reflex to adversity.
Yes.
For sure.
For sure. I would agree with you.
Yeah.
Took me a long time to learn that lesson, but I learned it, which I'm
Yeah,
thankful for. Yeah.
Well, I mean, at least you learned it.
Yeah.
True.
You know.
Yes.
The good, you gotta take the good with the bad, and you know, when you're in the moment, you know, a lot of the bad
It's
seems
awful.
so much longer than
You're
the good.
literally dying.
Yeah. No, so that I think that's extremely awesome. And going back to your practice, and the element of psychology, the discovery of a person's why. You know, when you're taking somebody in that transition from, I've taken all the pills, I've tried all the fucking diets, and none of it's working, right? What are some of the instruments, or like, how does the conversation go when you're trying to make that psychological leap of responsibility?
How does the conversation go? Fortunately for me, pretty easily.
Sure. You seem very direct.
Yeah.
So I don't see like that barrier being there for you.
No.
But
Because I think it's super important, because I've gone through my own shit. You know what I mean? And if I hadn't done that and all the work that I did, I would not be where I am today. I know that.
Sure.
So I think it's super important for people to have a why, or to figure out what is causing you to eat, you know, McDonald's 10 times a day, whatever the case may be.
Right.
You know what I mean? So for me, the conversation is basically, what are your concerns? What do you want to address? And it's not necessarily, people don't necessarily go, I want to address my anxiety or depression or whatever. It's sometimes it's that, but sometimes not. And I don't really force the issue, I guess you could say, but I do ask questions. And I think the more interest you show in people, the more willing they're open to up about things.
Sure.
And then you can get to that area. So it's not necessarily, I'm not a psychologist and you are only here to talk about this.
Right.
It's a more well-rounded sort of like, oh, like, what's going on with that? Tell me about that.
Sure.
And then they give you some story, and then you just, oh, well, what was that like? Like, tell me about that. So honestly, if you just show interest, it's really not that hard for people to just open up.
Right.
And then you can, you know, your third party, you can point things out like, hey, have you noticed how this correlates to this? And like, when you do this, also this happens. Have you ever like noticed that? And once you bring it to their attention, they're like, oh.
Yeah. You're connecting the dots.
Yeah.
Yeah.
Which is fun. So,
Sure.
yeah.
The in your path to this point, what are some of the instances or the instance that made you conscious of your ability to develop rapport? Because what you just talked about is not innate for most people, right? That character trait of getting somebody to like and trust you and be genuinely interested and inquisitive, like, that's extremely important to what you do, but how is that part of your being?
That's so weird to me that it's not. And you know what I mean? Like, people say that to me all the time. I'm like, there's no way people don't not care that much. But I guess that's true.
You'd
I
be
know.
surprised.
I would be, I guess. Okay. So when I was going through all my shit and trying to figure myself out, I was a very,
the headache part?
no,
Or what
no.
else?
The like my fucked upness. Okay. So,
Tell us a story.
oh no, I'll try to make it short. I feel like I'm
No,
talking
man,
a lot.
go for
No,
it.
go for it.
You're supposed to talk.
I know. When I was younger, childhood was not the greatest. Mom left when I was 5. Dad raised me with my brother. Dad was always at work, so it was really like nobody home. My mom wasn't around. You know what I mean? It all just really got to me.
Yeah.
But I didn't have an avenue to express that. My family is very much just don't bring it up. just ignore it. Like, don't talk about it. Don't do anything. Don't say anything. Like, you might start something. Like, they're very like that. And I love my family to death, but they are. And so it was like I had so much built up resentment and so much anger towards all the shit that happened in my life. But I didn't know how to properly like explain it to somebody or be vulnerable enough to say, look, like, this really hurt me and it really sucked. Like, can we have a conversation about it? So I never developed those skills. And so part of the reason I started Muay Thai was because purely compensatory mechanism to where I don't feel tough enough, so I'm going to go do something tough, and then I'll be like invincible and impenetrable and nothing will get to me, sort of thing.
Right.
So I did that, and then I got into med school, and it was like, oh, I got to be smart. I got into med school and this and that, and then you do these things, and then you still feel like shit. Like nothing worked.
Right.
It was like, man, I just still feel like a piece of shit, you know? And so luckily, I found this amazing doctor. His name's Dr. Moshe. He's in Canada. Hey, bud. He really helped me through all that and kind of just threw me into the deep end with trying to figure all of it out. But working with him really helped me kind of just figure everything out. And so I guess the continuing to feel like shit and then noting that like clearly you saying, hey, and being a friend to me is not making me feel any better. So I got to like work on something else internally and figure out what's going on.
Right.
And after I kind of did that, Pinterest, I read this quote on Pinterest and it just said, I know everybody's laughing, but it's so true. It's one of those like, but it just said, be who you needed when you were younger. And literally all I needed when I was younger was for somebody to talk to me and like, be like, tell me how you're feeling. What's going on? Do you see how this is doing this or what? You know what I mean? Just someone to understand. I didn't have that. So that's literally all I want to do for people now is just be like, oh, tell me about that. That really sucks. Like what's going on with that or whatever.
Sure.
So I guess that's how it
rock on.
That's really interesting. That's really interesting.
I want to know about your experience with Dr. Moshe.
I'm apparently a very interesting person.
Yeah.
This is great. No one's ever said that.
You don't suck. That's why you're sitting on this couch. So.
I know that.
So Dr. Moshe helped you fix that part. You know you don't suck anymore, so that's good.
Yes.
Props to Dr. Moshe.
He's amazing.
Tell us about that. Like, what did you guys work on for you? You know, since so much of that is internally self-perception, negative self-talk, lack of affirmation, all of those things. You know, is he a naturopath?
He is a naturopath.
Okay.
Yes. Okay. So this is a lot. So he came to the school.
Deep and dope.
It is. I like it.
Good.
He came to the school and I was a student. I think I was first year, second year, something like that. And I would literally, seriously, guys, get hundreds on tests. And I'd be like, I should have done better. Like, how the fuck can you do better if you got 100 on a test? That makes zero sense. It's stupid. So somebody sent out an email like, hey, this Dr. Moshe is coming in. He needs a student to demonstrate how he does his style of counseling on them. And I was like, maybe I should do it. So I signed up for it. And so I had previously been diagnosed with body dysmorphic disorder.
Sure.
You guys know what it is?
Oh, yeah.
Okay.
Bodybuilders.
Fair enough. Well, I don't know. So I was previously diagnosed with that. So I told them, like, this is what I've been diagnosed with. This is what I'm trying to figure out, so on and so forth. And so in front of, like, I don't know.
To cut you off real quick.
Yeah, go.
What end of the spectrum were you on? Were you self-perceptually too big or too skinny?
Too big.
Okay.
Yeah.
Go.
So I sat down with him in front of like, I don't know, fucking 150 people or something like that. Yeah, like everybody showed up to this thing and it's fucked up because nobody ever showed up to most of the other club shit. And I was like, what is happening right now? And so that was really hard. But so he sat there with me and he just asked questions. And he asked the right questions, and I can't tell you exactly what those questions were,
right.
But he very much connected the dots for me. And he very much made me go to a level that was much deeper and much more self-aware than I don't look like a model on TV or whatever the fucking case may be. You know what I mean? My ass is too small or whatever. And so he helped me just to really reflect on where everything came from. And once I was able to make those associations, it was like, okay, I do this because this happened. How can I reroute and handle it a different way? And so I would literally explode in people's faces. I would get in their faces and I would yell at them and I would say mean things. Like, I didn't care.
Wow.
I just wanted to like hurt people, basically, is where it was coming from. So it was a lot of just talk like that, you know. He also used homeopathy. I don't know if you guys know what that is.
Explain.
Oh, it's another very long story. Homeopathy, super safe, super simple, effective medicine. Very individualized. So there are like, I don't know, 300-400 remedies that you could pick from, and they all have a very distinct set of symptoms.
Sure.
And so the remedies are given based off of how one would present with symptoms. So it's not just like, I'm angry, and they're like, here's a Xanax.
Right.
It's very much more in depth, much more involved. So he used that with me, and it helped to just kind of like clear the background noise, I guess, kind of shut my mind up a little bit so I could actually see what was going on instead of just making shit up in my head.
Right.
So just a lot of counseling with him and a lot of crying and like, I suck, no you don't, like, you know, just going back and forth and just working through it.
Yeah.
So
How long did that process take to finally, or is it still an ongoing process, but the initial discovery of that?
I would say a good 2, until I started to feel better, maybe probably 6 months to a year. Because it's not easy to go from a lifetime of like thoughts and beliefs and this and that to something completely different. Like you really have to stand there and face your shit, and that's just scary. So for me, it was like 6 months to a year, and then every once in a while, still like it's still an ongoing thing. Like shit will creep back up, like especially with the business. I'm like, what am I? Why do I even do this? Like, who am I? I'm nobody. I'm from Ohio. Like they don't do anything. No offense over there.
Max is like, go act.
I know, right? So yeah, every once in a while, I'll still just give him a ring, and I'm like, "This is happening. I don't know what's going on," and he just asks questions, and he helps me walk through it, and it's like, okay.
So when did he make the transition from professor, educator in your life to mentor? Because that seems like the seat that he sits in right now.
He very much so. Pretty immediately, if I can be honest. And I think he's amazing, but I also think he was the only person ever in my life to really take the time to sit and listen. And I know that's what I was paying him for.
Sure.
But I had been to counselors previously, and it was never fucking like that.
Yeah.
You know what I mean? I remember one session I literally just sat there out of spite and didn't say a fucking word for an hour.
Goodwill Hunting style.
Yeah.
Yeah.
I don't know. I was just like, why am I here? This is stupid. Nobody helped me through anything except for him.
Yeah.
And so after that, and because of the progress I was making, I guess it was maybe like a year or so.
Sure.
To where I was like, damn, like I want to learn how to do that. I want
There you go.
to, I want to be that for other people.
Sure.
So
Yeah.
yeah.
So in saying that, how would you define your purpose at this point and, down the road?
Jeez, guys. Shoo-wee. My purpose in life?
In life.
Is just to make other people's lives better, to help them get to where they want to go. I don't know. I feel like I'm more of a coach than I am a doctor.
There you go.
I don't know. I love the medicine, but also I would rather, like, if you have a goal of something, even if it's not medicine related, like,
sure.
I want to fucking help you get there in whatever way I can.
So,
I love that.
from a diagnosis, what's the best way to put this question?
Just asking.
What's your favorite mode of treatment?
Oof.
Like if your avatar, like the perfect patient, came to see you, like Is like what do you love about treatment? Is it like natural remedies? Is it acupuncture? What is your what's your jam? It's like, yes.
This is totally off what we've been talking about, but like minor surgery.
Really?
Yes.
What constitutes minor?
So anything above the muscular layer
So
that would
pulling out thorns?
Yep. So suturing, lipomas, abscesses, things like that. And it's because you get to like work with your hands, and it's not pretty when you start, and then you get to make it pretty.
Interesting.
done.
That's the last thing I thought she was going to say.
I know. I told you it's completely off topic.
That's interesting.
But if someone came to me and like, I have this lump, I'd be like, yes, sit down. We're going to fix that.
That's how Dr. Pimple got big time.
Yeah. I'm telling you, she's awesome.
She crushes it.
She's
That shit's
amazing.
gross.
You think so? Oh, that thing, dude, it's
No.
relaxing. Just like,
I would agree with you.
it's soothing to see that. I don't know why.
When you see all this shit come out, you're just like, oh,
It's so
thank God it's
purifying.
out. Yeah.
You're both
Yo,
disgusting.
give me a high five on this one, doctor. It is so
you.
purifying.
It's so fun. It's so fun. But while they're sitting there, you get to talk with them about their life and like whatever, you know what I mean? So
Sure.
I don't know. I just like people.
I dig it.
Yeah.
I love that though, because the best doctors, you know, even in my time when I blew my knee out, the best doctor I had, Dr. Jeffrey, he was fantastic, man. But he got to know me as a person, not just sitting there, move your knee, do an ACL test, blah, blah, blah. He got to understand like my background as a person and really diving deep. So by the time I was on the surgery table, it was like I was comfortable. I wasn't, you know,
Yeah.
apprehensive about getting cut
Totally.
open. I just woke up and I was like, damn, it's time to get back out
Good
there
job,
again. You know
bud.
what I mean?
Yeah.
Yeah. So
Yeah.
it's that, you know, the social aspect of building that rapport is super important. I think,
Yeah.
like you're mentioning, a lot of people miss that in this world that we live in.
Yeah.
You know, and that's part of being a business owner, a doctor, or just a friend, just being there to listen and, you know,
Well, I think that's
Totally.
that's the element of the deal that as connected as we've become via technology, that's where it kind of backfires because we're not genuine. We're living in this microwave of interaction
right.
where you know, if I don't want to deal, I just stop texting.
Yep.
You know what I mean? Or I can create literally my own universe on social media where I only see the good things, the butterflies, the pretty people, you know what I mean? And it completely puts the blinders on to the adversity or the negativity that actually goes on in the world. And I think that filters into our ability to have honest, authentic, vulnerable
Totally.
conversation, you know, and I think some of those words have become, you know, cliche, you know, in the here and now, vulnerability and authenticity and
Yeah.
stuff like that. But it's still very true.
Totally true.
You know what I'm saying? Like, I would much rather be uncomfortable for 5 minutes and tell you exactly how I feel than walk on eggshells or let something great fall apart because things were left unsaid.
Totally.
You know what I'm saying?
Absolutely.
And that's how resentment builds too.
100%.
You know what I mean? Like you don't
Yeah.
get to say what you're feeling, and then all of a sudden you're pissed off.
Right. But now I'm not pissed off. I'm not pushing that anger on you, who I have issue with. Now it's on Jeff. It's on Max. Like everybody pisses me off.
Yep.
You know what I mean?
Yep.
Because I didn't have a conversation with you.
Yep.
Right.
Which, you know, doesn't make any logical sense, but it is indeed the human condition.
It is.
Yeah.
It is.
Yeah.
I think also too, people, the words like genuine and vulnerability, they consider it like a weakness.
Oh, sure.
Yeah.
Absolutely.
And it was funny because you had said while we were at coffee, you were like, something about crying. I don't remember exactly what it was, but you're like, I had to learn how to cry, or what? You said something about crying.
Well, I did.
You did.
Funny thing. I'm all about crying.
Yeah.
I am a crier.
Yeah.
But
I'm gonna make you cry.
check this shit out. This for anybody that's walking the entrepreneurial path right now, go see The Greatest Showman.
Is it going to make you cry?
It's the musical with Hugh Jackman and
Yeah,
Zac Efron.
Yeah.
Okay.
I saw the commercials for that shit, and I was like, that's dumb. Definitely not going to see that shit. Nicole's like, my wife.
Yeah.
She's like, you have to see it. You'll love it. It's about P.T. Barnum and how he built the
Yeah.
circus, right? Bro, I shit you not. 15 minutes into the movie. It's 2.5 hours long. 15 minutes in.
Waterworks. Already.
What?
Waterworks.
Yeah, and then 3 more times throughout the shit. I was like, man, I know what you're feeling, bro.
Right?
I've been there. I need to learn the words of the song.
Man.
But like, I think that it's being able to just allow the things that strike an emotional chord, to just be, is extremely fucking important.
Yeah.
You know what I mean? Like, in my 34-year-old self, I'm way more mature than my 23-year-old self. But, just being able to sit in a movie, either right next to my wife or in a theater full of 100 fucking strangers and be able to just feel whatever I feel, like, I'm great with that.
Totally.
And I look back on other experiences prior to, the progressive awakening I've had over the years. And I'm just like, God, I would have that same experience and just have like this visceral reaction to wanting to cry. And I can remember having like this interior dialogue, like, dude, just cry.
Yeah.
Like, it's fucking okay, And it's like in the conscious part of my brain, I'm having this discussion with myself. But there's another part of it, this affront that I have, this ego that is like, nah, man, don't do that shit.
Yeah. Yeah.
Like that's not cool. And, as I've improved my circle of influence and been around, especially men that are redefining what it is to be masculine, I'm completely cool with it. Like, I don't even give a shit anymore. Like, that shit's sad. I'm going to go ahead and, I don't cry like, panda scratching bellies or anything like that. But, when it strikes a chord, it's cool to let it go.
Absolutely.
You know what I'm saying?
Absolutely.
It's healthy.
It is healthy.
While we're on the wellness tip, but that's still perceived to be in society at large. It is extremely unappreciated, and it's not. And I honestly think that, as a man, that when you're growing up to be G.I. Joe and, playing football and being a Marine and doing all these things, this culture of like aggressive aggro masculinity, a lot of that just gets pushed to the back and it's not embraced until some really traumatic shit happens, right? And then you get to see somebody, what my dad would describe as emotionally naked, right? That's when you find out the true essence of somebody. You find out what they're really about, where their breaking point actually is, and if you're okay with being vulnerable, you don't ever have to go that far to discover that about yourself. And that's something that can be taught and should be embraced.
Yes. I would agree with you 100%. Very well said.
Oh. I practiced on the way over.
Thank you for sharing. You did not. You did not.
But anyway, go see The Greatest Showman, because that shit is, it's like that, for real.
Interesting.
Yeah.
I always click on it and I'm like, and then I pull away from it. I don't know why.
Me too.
I was like, later.
I'll tell you why I clicked on it, because it's a musical and we were sitting down for dinner and I wanted to keep my son occupied. He likes music. He likes elephants. Cool.
Done.
Next thing I know, he's sitting there eating chips and guacamole and I'm just
crying.
Man, just blubbering.
That's awesome.
Yeah,
I'm a sobber too. It's embarrassing.
Got snot running down your nose. Excellent.
Grab the tissue.
Excellent.
It's on.
Hits an emotional trigger. Yeah, it's weird. That stuff pops up sometimes, man.
Yeah, man. Yeah. But no, I think it's really cool what you got going on. I really enjoy your perspective on the whole deal.
Yeah, seriously.
You know, because your approach is very much not so much very much the person as a collective.
Yeah.
You know, not just the body as a system.
Yeah.
Like, okay, you're obviously here because you want change. But above and beyond that, why do you want to change? You know, and is it bad enough for you now that you'll stick with whatever treatment protocol we decide to come up with? Because like you said when we sat down for coffee the other day, it's not sexy.
No.
It's hard.
It is.
And it takes a while.
It does.
You know, what you were talking about, working with your mentor, you know, it was a 6 to 12 month process for you to like be consciously all right with yourself.
Yep.
Like that's the shit that nobody wants to hear. You know, by the way, for you to get from point A to point B, you're looking at 12 months.
Yep.
Just so you know.
Yeah.
Right. And that's a very like that in real time, you know, 12 months goes by like that.
Super quick.
But in the here and now,
Yep.
it's like, oh my God, that's so far away.
Yeah.
You know? So, you know, the fact that you have the ability to be as direct as you are and still accomplish the monumental task that is developing trust and rapport with somebody, that those two things most of the time in my experience are mutually exclusive. You know, people that have your directness in dealing with stranger interaction are like, she's a raging bitch. He's a fucking asshole. You know what I mean?
Yeah.
They told me all the things I didn't want to hear, and that's not why I came here. You know, but you have the ability to flip that on its head and tell them exactly what the hell's going on. And at the same time, we're going to create a relationship.
Totally.
We're going to take this thing the distance.
We're going to be friends.
You know?
Yeah.
And I think that's massive. So I think the movement that you're on, you know, is only going to pick up momentum.
Thank you.
Yeah.
I appreciate that.
So before we let you get out of here, I want to ask you 2 questions.
Uh-oh.
Answer them on any level.
I didn't
mental,
sign
physical.
up for this.
That's what you hear now.
I'm just kidding.
Right? Remember that deep end thing?
Yeah. I
Start swimming.
throw them down. Oh,
Right.
jeez. I hate the ocean too.
Me too.
Right? Sharks.
Me too.
I'm just
That's
saying.
because that's another story.
You were eaten by a shark?
Oh no.
Oh. I was like, oh, God, I don't want to hear
Have you
it.
seen all the shark memes from the hurricane?
No,
No.
I don't want to
As
see
tragic
it.
as all that shit is, like they're creating this like Sharknado scenario.
Oh my
like
God.
sharks are blowing in. Like,
It's a
it's
mess.
fucking hilarious on Google. Check it out.
It's a
There's
mess.
all
That's
kinds
terrifying.
of memes. But anyway,
Okay.
question number 1. I'll ask them both, and then you can answer.
Okay.
First of which is, what do you do each and every day to feed yourself and stimulate the energy to do what you do on a daily basis? And the follow on to that is, what do you do each and every day to fuel yourself and make sure that that energy is sustainable over the long term?
So the thing that I do every day is work out easily. I know that if I don't work out, you just feel lazier. I don't know. You know what I mean? So then shit doesn't get done. You're like, oh man, I didn't get it done.
Right.
So if I just start and I work out, I'm good to go.
Yep.
What do I do to fuel? What was the other one? Fuel myself
Create that
to sustain
sustainable.
the energy. I envision what it's gonna look like when every person is aware that they deserve more out of this life. Because I think we settle, and I think that's shitty, and I think we should all go out and do fucking amazing things.
That's good. That's a good one.
I love it.
Yeah.
Thanks.
I wasn't expecting it. That one's
No.
a damn good one.
That's massive.
And then where can everybody in this community go follow you and support you and your business and everything that you have going?
You can go to my website, aleniahealth.net. Thank you. Yes, I said it correctly. I do know my own name. I'm on Facebook at Dr. Rachel. No, it's Alenia Health now. I don't know. I just change it. Look up Alenia Health or Dr. Rachel Hasselbrock, either one. I'm on Instagram, but let's be honest, I'm actually never on Instagram. So if you follow me there, you're gonna get like,
should
I know. I just don't care. I know.
You will.
I don't right now. Like
You get it.
fuck.
Don't worry.
Fucking
We'll talk.
social media. I don't like it.
It's the world we live in.
I know. I'm such an old soul. I'm like, give me a paper book.
I feel like I was the last CrossFit box to get on Instagram. Like, yeah, I feel you. I've been
I don't know. People always like my life, and I'm like, I don't know. I'm just fucking writing on my vision board. Like, nobody gives a shit about that. Yeah, that's weird to me.
You'd
Like,
be surprised.
I know, but then part of me is like, why don't you go make your own vision board? Stop looking at mine.
Be the inspiration.
I'm trying. So yeah, those 3 places.
Okay,
would be good.
awesome.
Thanks
Yeah.
for asking.
Yeah,
Uh,
appreciate you being on.
Yeah,
Seriously.
absolutely.
Dude, thank you for having coffee with me the other day,
Thank you.
and then B, entertaining the idea of being on the show today.
Yeah, seriously.
I
And-
appreciate you guys
and-
having me.
and being so deep and dope
Thank
with
you.
us.
Thank you.
For everybody out there in Feed Me, Fuel Me Land, make sure you get out there and check out everything that Dr. Rachel has going on. And if you're interested in anything naturopathic, you now have a go-to resource.
For sure.
Resource. So, thank you so much.
Thank you.
Thank you.
Yeah.
I appreciate it.
Awesome.
You guys are awesome.
You are
Appreciate
awesome.
No, you're awesome. We're all fucking awesome. Even Max over there crushed it.
He's from Ohio. I
Yeah,
guess.
he's
It's the Ohio
automatically
connection.
awesome.
That's already awesome right there, right?
He's got to be.
All right, got.
Do you have something?
Until next time, guys. Feed me, fuel me.